although the main organs that involved is the joint, but it's not as simple as that. It's a systemic disease, meaning there are other organs in the body can get involved in a patient with rheumatoid arthritis. So common things will be eyes. So the common symptom of the eyes affected in rheumatoid arthritis will be dryness. They get dry eyes. Because of dryness, they get some pain. Sometimes they get a bit of redness. The more severe manifestation in the eyes will be some inflammation in the lining of the eyeball. So a condition that we call episcleritis or scleritis. I'll show you some photos in a while. And the other common symptoms, non-joint, non-muscle symptoms will be dry mouth. So patient can have such bad dry mouth that they feel when they eat, there's not much of taste. Because of no saliva, they can get very bad oral hygiene, and they can get a lot of caries in the teeth. Another common sign will be they develop lumpy nodules underneath the skin, usually over the elbow region, or can be some elsewhere, but the most common area will be the elbow. They can also have more severe problem in the more important organs, such as the lung. Luckily, this is also not very common. They can have inflammation or scarring inside in the lung, which we call interstitial lung disease, or another condition is bronchiolitis or obliterans. These are severe diseases. They lead to severe breathlessness and sometimes not very easy to treat. Some patients may have inflammation in the blood vessels, depending on which organ they go to that is involved. If it's the skin, they get rashes and they get ulcers in the skin. If rheumatoid arthritis is not well controlled, they get anemia, meaning lack of red blood cells. So they get anemic, they'll get tired. If very severe, they can get a bit of breathlessness while walking. People can get inflammation of the heart muscles and get arrhythmias. You get everything from head to toe. Something is very rare that I didn't put up here. It can affect the liver, conditional Felty syndrome, where the liver become enlarged, and it's associated with low white cell count as well. It can affect the skin. So it depends on where about the skin. So you can form ulcer at the tip at the toes or fingers. So I'm going to show you some photos about what happened to the eyes. These are more severe form of eye involvement. It's a condition we call episcleritis, where the layer of episclera get inflamed. So you can see a bit of redness here. So a bit of deeper layer called sclera can get inflamed. Then we call it scleritis. So you can see this lady, both eyes are inflamed. So what happened will be if this condition is not treated promptly or recurrently keep happening, then this particular area called sclera, after many episodes of inflammation, it gets thin. When it gets thin, you can see when it gets thin, the inner layer, which darkish color can be seen. You can see this area here is so thin that you can see the darkish area here. And if still not treated properly, the next thing we know is that it's so thin that it's going to perforate. So there's a name. This is called episcleritis. This is called scleritis. This is called scleromalacia. This is called scleromalacia perforans. They mean it perforate, going to perforate, and the content of your eye can just come out through this hole here. So it's not a mild condition that you can just ignore. So this is dry eye. You may think that dry eye is not important, but it is important because of if you don't get enough moisturizing eye drops, lubricating eye drops. Chronic dry eye, it leads to erosion of your cornea. I see this one, you put a stain on it, you can see dots of erosion over the cornea. Besides painful, over a period of time, it causes scarring. If this scarring happen to be in your axis of your pupil, then you are going to have very blurred vision because the light cannot go through. So this is dry mouth. You can see that this is the tongue is so dry. So you can imagine how you're going to swallow without saliva, or your food will be quite tasteless without saliva. So rheumatoid nodules, in general, indicate that the patient's rheumatoid arthritis is more severe. Earlier you get erosion, but you don't need to remove this. This rarely happens in somewhere else. The most common place will be at the back of the elbows. And sometimes it can be mistaken as a tophus, meaning those gout crystal deposition. But this, if you examine them, it feels very different from the tophus in gout.